After a stroke, walking, talking, and thinking can be significantly impaired. Immediate therapy is crucial for stroke survivors to regain their abilities and enhance their quality of life. Our program includes specialized physiotherapists who focus on restoring independence and quality of life. Advanced balance training enhance strength, stability, and coordination. Robotic gait training optimizes walking recovery through precise, repetitive movement tailored to each patient needs. After a stroke, you might find it challenging to move your arm and hand. Occupational therapy focuses on improving motor control and hand function. Therapists use robotic equipment like robo-glove and specific exercises to regain finger movement, hand strength, coordination, and dexterity. Patients with slurred speech, difficulty with language, and swallowing difficulties receive targeted treatment to improve communication and enjoy their favorite food safely. Emotional challenges like depression, anxiety, and frustration are common among stroke survivors. Our clinical psychologists use therapeutic interventions to help patients develop healthier coping mechanisms and improve their emotional well-being. We also support patients with a fear of falling through breathing techniques and positive behavioral support, helping them regain confidence in their daily movements. Neuropsychological assessment evaluate readiness to return to work, ensuring cognitive and emotional preparedness for job demands. Recovering from a stroke is no small feat. Every word spoken, every step taken is a testament to our courage and determination. The road to recovery may be long, but with perseverance and positive spirit, we can reach incredible heights.